Good evening to everyone and welcome to today's session. Let us play many quiz tournaments together every day, every hour on the Incus quiz app. I wish most of you have downloaded the Incus quiz app and even without the availability of teacher, still you can play a lot of autoplay quiz tournaments yourself. Go to the history and you have the explanation, revision, you can add comments, everything you can do on the quiz tournaments. So if you look at the Incus quiz app, I'm showing you the web interface of the app. So you have nearly 440 tournaments, almost 9,000 MCQs are made available, and every day you have live upcoming tournaments. So 20 tournaments are the live upcoming tournaments that you can be able to play. So you can go to the Incus quiz app and can come. Otherwise, tonight I want to play this game, image-based MCQs quiz. So this is already over. The time is over. It was a previous quiz. So that's the reason it comes under completed tournaments, otherwise autoplay tournaments. So let's make the great beginning. A 72-year-old man sustains injury. His radiograph is being shown to you. What is the position that you expect him to, typically what will be his attitude? So if you know what kind of injury, is it intratrochanteric or extracapsular, intercapsular, you can answer that question. 80-year-old woman sustains a mechanical fall onto her right side. Her radiograph has been shown to you. Now the question comes, what is the most appropriate treatment? So it is basically, does it require the intervention or not, is very, very important. Now, the upper thoracic spine has been shown to you. Now the question comes, what is this in case of tuberculosis, which part of the spine is most commonly involved is very important. So similarly, how do you differentiate one kind of disc involvement versus no disc involvement? How do you differentiate a metastatic lesion of the spine versus that of the TB is important. So what is the commonest lesion of this kind of an intramedullary tumor on MRI is a very, very important question. Yes. Yes. Now, Yes. So what is the feature that favors brucellosis versus tuberculosis of the spine is a very important question. So you should be quite sure that it is the involvement of the lower lumbar vertebrae is an important indicator. Now, what is this condition basically? What you're seeing here is the spondylosis of the spine. So that is the reason end plate osteopenia is an important indicator that clinches you the diagnosis of the spondylosis. So now, what are these called as? These are called the Dawson's figures. So now the question comes, what are the important features in multiple sclerosis? And so the presence of these Dawson's figures are very characteristic feature. So the Dawson's fingers. So you should remember very much that what characterizes the multiple sclerosis. Now, what is this condition that you are seeing in this, and where do you see this? Typically, this is a periventricular leukomalacia, which is seen in case of premature infants, is what you need to basically remember. So whenever the premature infants happens to suffer hypoxic encephalopathy, then it is the periventricular leukomalacia is what you need to remember. Now, in this imaging, you can much better see it when you are on the mobile app, the images. So multifocal white matter hyperintensities, what do they suggest? They suggest vasculitis, vasculitis is not the suggested, but metastasis, multiple sclerosis, etc., etc. So what is this arthritis? It's called arthritis mutilans, which is a deforming arthritis, which is very characteristic feature with the cup and pencil appearance, it is called as, which is seen in the case of the psoriatic arthritis is what you need to remember. Psoriatic arthritis. So, psoriatic arthritis, very good. Swapnil is very ceremoniously answering the questions correctly. Now, a patient presents with urethritis, red dye, and a lesion which is being shown as what you can see here. So, what is true about this condition? So, you should remember Reiter syndrome, which is very common in the young males. So, typically, Reiter syndrome has got a classic triad of arthritis, urethritis, and uveitis. So now, with regarding to this lesion, so what could you see in this lesion? There's a cupping and splaying of metaphysis, which can be a feature of rickets, which can be a feature of copper deficiency. It can also be seen in metaphyseal dysplasias. Cupping and flaying of metaphysis is what you need to remember. So, Swapnil could not make it, but he got a good score of 5,000 points. Very good. A young child presented with backache without soft tissue swelling. The radiograph is being shown. So that is a very important clue. For the Langhans cell histiocytosis. So what is this very classical feature you are seeing? There's a flattening which is called vertebra plana, which is the characteristic feature which you see in the case of the Langerhans cell histiocytosis is what you need to remember. Very good. Swapnil cracks another 1000 score for this. So you need to download the Incus quiz app. We have recently updated the new version of the app, and now you have the bookmark feature. For every question there is an explanation. So many new things. You can add comments to every question. So many new features are added. So please don't forget to download the Incus quiz app, and we are going to play a lot of games. Every hourly we are going to play the contest on the Incus quiz app. So the radiographic feature which is being shown here. Now you are able to see this radiographic appearance. So what does it basically suggest to you? Is it osteoarthritis, rheumatoid arthritis? This is more rheumatoid arthritis. So you should remember, excessive physical activity in rheumatoid arthritis can lead to more severe forms of joint disease is what you need to basically appreciate. Now, the next question. What is wrong about the diagnosis of this condition? So first, you need to make up what is this condition. So typically osteoarthritis, where there's a narrowing of the joint space. So spiking of the tibial spine is a early feature in case of the osteoarthritis is what you have to appreciate. Now, doctor, with regard to osteochondrosis, which is being shown in the figure, what is a true statement? Always a rigorous physical activity is one of the important predisposing factor for the osteochondrosis is what you have to basically remember. Now, doctor, the next question. So what is this called as? Very classical question. Scottish Terrier dogs, broken neck collar. So what is this radiographic sign which is being shown? So you should know how to make the diagnosis of spondylolisthesis is what I want to underscore to all of you. So once you go to the Incus quiz app, then you can be able to see a detailed explanation of this question, how your other friends across the world who answer this question are answering. You can add some comments, you can upload some handwritten images, everything you can do on the Incus quiz app. So don't forget to download. So this kind of a spot of the blood from the nipple. So what does it remind you? It reminds you of papilloma. That papilloma typically presents with a bloody discharge is what you need to remember. Now, the next question. What is this cheesy material which is discharging? Basically, where do you see this kind of a cheesy material which is discharging? So you should remember that it is the cheesy material is duct ectasia is what you have to emphatically remember. So this is how the quiz is played. There are nearly about 10,000 questions as on today, and there are many more questions which are coming up. And once you answer, Swapnil has answered 11 out of 20 with almost 11,225 points score. Very good. So I want you to play more and more quizzes, spice up your preparation, catch up with what are the weak areas, strong areas, everything in comparison with your classmates. Thank you very much for joining this quiz tournament. Many more tournaments, we will have a discussion also. So, but otherwise you can always play them on the Incus quiz app. Thank you. Goodbye.